Today, I'm going to discuss basic concepts and features of odontoma. Odontoma is most common odontogenic tumor. It accounts for 22% of all odontogenic tumors. It is seen during first 2 decades of life mostly and equal in both males and females. Odontomas are considered to be developmental anomalies or hamartomas because in it the growth of completely differentiated epithelial and mesenchymal cells gives rise to ameloblasts and odontoblasts, which in turn form enamel and dentin respectively. Also, variable amounts of cementum and pulp is seen. So, it is an hamartomas odontogenic lesion with limited growth potential. Unlike typical benign tumors, the enamel, dentin, cementum, and pulp are formed but are disorganized. Histodifferentiation is complete in case of odontomas, but morphodifferentiation is incomplete. Odontomas can have etiology also, mainly trauma and infection. Family history of the patient and genetic history is also important and can have contribution in growth of odontoma. Hamartoma is a disorganized mass composed of tissues which are native to particular anatomical location. They grow at same rate as of original tissue. Histologically, there is a haphazard growth of normal tissue and there is disorganized architectural pattern of cytologically normal cells. Histologically, this feature differentiates a hamartoma from a benign tumor because in benign any benign tumor has disturbance in both architecture and there are cytologically abnormal cells. Examples of hamartoma in human body are pulmonary hamartoma, hemangioma, polyps, nevi, cardiac, rhabdomyomas. Many of these are also they are considered as benign tumors. So, odontoma is also considered as hamartoma. So, odontoma is a mixed odontogenic tumor formed by both epithelial and ectomesenchymal cells. It is a growth which mostly consists of tooth bearing tissues, whereas odontoma as hamartoma is there because tissues are normal morphologically. There is disorganization in structural arrangement of tissues, although enamel and dentin are formed but are not balanced to form normal anatomical structure of tooth. So, here, by all these points, we can conclude that odontomas are number one, developmental anomalies, number two, they result from growth of completely differentiated epithelial and mesenchymal cells, and number three, ameloblasts and odontoblasts form enamel and dentin respectively, and number four, there is disorganization of complete structure. During earlier developmental stages, odontomas contain proliferating odontogenic epithelium and mesenchyme, whereas when these are fully developed, there is formation of enamel, dentin, variable amounts of pulp and cementum. The term odontoma was coined by Broca in 1866. It is formed by overgrowth of complete dental tissues, formed of enamel and dentin, but can have variable amounts of cementum and pulp tissue. Clinically, radiographically, and histopathologically, there are two types of odontomas. One is compound odontoma and other one is complex odontoma. Compound odontoma, clinically or radiographically, has both enamel and dentin, but they are not oriented properly. And there is only anatomical similarity to normal tooth. Whereas complex odontomas have dental tissues which form an irregular mass and in disorderly pattern. WHO defines complex odontoma as malformation in which all of the dental tissues are represented and individual tissues mainly are well formed but occur in disorderly pattern. Odontomas are common in first 2 decades of life. The compound odontoma is twice as common when compared to complex odontoma. Some of the studies indicate that complex odontomas are more seen in women than in men. But overall, many of the studies indicate that these are equally found in both males and females. Regarding the location, compound odontomas can be found anywhere in the dental arches. Majority of odontomas are located in which are located in anterior region of the maxilla are compound odontomas, whereas complex odontomas occur in posterior jaw and they affect mandible mostly. The etiology is largely unknown, but trauma infection can offer ideal conditions for its appearance. Family history and genetic factors are also important in odontoma. Some of the studies indicate that 70% of odontomas are associated with some pathological changes. For example, impaction, malpositioning, aplasia, malformation of teeth, and devitalization of adjacent teeth. What are the clinical features of odontomas? Odontomas are mainly asymptomatic. They can cause asymmetric tooth eruption, malposition of erupted teeth, and sometimes devitalization of the adjacent teeth. Due to secondary infection by infection, local trauma, or sinusitis, they are associated with pain and swelling. They are small tumors. The range varies from several millimeters to 6 centimeters. And most of the tumors are between 1 to 2 centimeter in dimension. Odontomas are also seen in Gardner syndrome, which consists of multiple odontomas, osteomas, supernumerary teeth, or epidermoid cysts. Odontomas are also associated with orthodontal syndrome. So, overall, the size of odontomas is small. Occasionally, they can be large, and when large, they can cause expansion of the cortical bone. They are discovered mostly in second decade of life. Many times, odontomas are found associated with unerupted teeth and also with missing teeth. Any tooth can be involved by odontoma, but canines, upper central incisors, and third molars are the most frequent teeth impacted by odontoma. Radiographically, there is a calcified structure. This calcified structure can resemble teeth or doesn't resemble teeth. In compound odontoma, the calcified structure resembles teeth anatomically, and there is radiolucent lesion in which radio opaque structures are seen, whereas a developing odontoma can be discovered by routine radiography, but due to lack of calcification, we can't differentiate it radiographically. The complex odontomas appear as irregular mass of calcified material surrounded by thin radiolucent line with smooth periphery. Sometimes periodontal or pericoronary space is seen around unerupted tooth. Now, histopathologically, odontomas contain mature dental tissues. That is, they can contain enamel, dentin, pulp, or cementum. The compound odontomas, pathologically, are formed by tooth-like structures which have pulp tissue in the central portion, number one. Number two, they can have dentin shell. And number three, enamel surrounding this structure. Whereas complex odontomas are irregular eosinophilic areas which are calcified structures. Their masses, without proper orientation of dentin, enamel, matrix, cementum, or areas of pulpal tissue. Also, the capsule of connective tissue that surrounds an odontoma is similar to the follicle that covers a normal tooth. Ameloblastomas can resemble ameloblastic fibrodontoma, odontoameloblastoma, osteoma, or calcifying epithelial odontogenic tumor. Ameloblastic fibrodontomas, because they can occur in first or second decades of life and also are radioopaque structures. Odontoameloblastoma, again based on the age and on radiographic examination, resembles odontoma. Osteoma, based on clinical features and also radiographic features, resembles odontoma. If calcifying epithelial odontogenic tumor is small and based on its location, which is mainly in mandible, can be an important differential diagnosis of odontoma. These are treated by conservative surgical removal. There is little probability of recurrence and prognosis is good. Now, to conclude, we'll discuss some of the multiple choice questions. The most common odontogenic tumor is correct option among all these four is odontoma. Option number B is correct. Odontoma, ameloblast is second most common tumor, odontogenic tumor, and odontoameloblastoma is rare tumor, and common odontogenic tumor is again not a common tumor. Correct option here is option number B, odontoma. Compound odontomas are seen more in these are more commonly seen in anterior maxilla is the correct option, because in posterior mandible complex odontomas are seen. Anterior mandible, some of the cysts are more common, and in posterior maxilla can have ameloblastoma also. So here the correct option is anterior maxilla. Compound odontoma is more seen in anterior maxilla. Etiology of odontoma can be one of the following. The most common considered etiology of odontoma is trauma. Option number A is correct. Histology of compound odontoma is, it is option number A, tooth-like structure which resemble pulp tissue in the central portion, surrounded by a dentin shell and partly covered by enamel. It is the common option. It is best option, because option number 2, masses of odontogenic tissues without proper orientation, is histopathological feature of complex odontoma. Option number C, sheets or islands of cells surrounded by tall peripheral columnar cells, is histopathological feature of follicular ameloblastoma. So here option number 1 is the best option. Pathology of compound odontoma is tooth-like. There are anatomically tooth-like structures. Odontomas are mostly seen in first 2 decades of life, first or second decade of life, common in 10 to 20 years of age. The mean age of occurrence is roughly 16 years. So option number A is correct, first or second decade. Middle age, ameloblastomas, old age, some of the salivary gland tumors are more common and not in a very rare in unit. So option number A is correct, first or second decade of life. True about odontoma. They don't assume large size. Option number A is wrong. Pathologically contains cystic spaces lined by epithelial cells. Option number B is wrong. They are radiopaque radiographically. Option number C is wrong. So none of the above is the correct option here. Odontoma is it is option number C is correct. Mixed epithelial ectomesenchymal odontogenic tumor. It is not epithelial odontogenic tumor like that of ameloblastoma, COT, SOT, or AOT. Not ectomesenchymal odontogenic tumor like that of odontogenic myxoma, cementoblastoma, or odontogenic fibroma. It is not variant of odontogenic cyst like that of cystic or we can say dentigerous cyst or periapical. No, not a variant or clear cell variant. It is not option number D. So here odontoma is option number C, mix epithelial ectomesenchymal odontogenic tumor. Odontoma has incomplete, it has complete histodifferentiation. Option number A is wrong. It has incomplete morphodifferentiation. It is correct. Also, it can have incomplete calcification or mineralization, but here there is incomplete morphodifferentiation. That is very important cause of odontoma. So it is also called considered as hamartoma. So option number B is correct. Odontoma has incomplete morphodifferentiation. Although there can be incomplete calcification and incomplete mineralization also, but option number B is most correct and most preferable of option. Option number odontoma is incomplete morphodifferentiation. Option number B is correct. I will see you again in some of other important lectures. Thank you.